Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about hypertension and its effect on multiple different organs in the human body. When I left off, I completed the series on the effect of hypertension on the brain. And in this segment, I'm going to talk about the effect of hypertension on the heart. Now, in this country, some 76 million folks have hypertension, and some 67 million folks have so-called prehypertension. Worldwide, there are 1.5 million people with hypertension, and roughly 7.5 million people every year die in the world because of the effect of hypertension. Of all the organs that get affected by hypertension, of course, the heart takes a tremendous beating from the effect of elevated blood pressure. Now, once the pressure becomes elevated, several things can happen to the heart that can ultimately lead to either coronary occlusive disease, resulting in a heart attack and cardiac arrhythmias, what have you, chest pain, etc. And or the heart can become very enlarged, resulting in congestive heart failure. Now, congestive heart failure can result from ischemic heart disease as well, as a result of damage that's done to the muscle of the heart with hypokinesis. That part of the muscle is pretty much been destroyed. The heart loses some of its ability to pump, and you can go into heart failure that way. But more often than not, the individual who have not had a heart attack, and yet they have heart failure because of the effect of hypertension on the muscles of the heart. Now, in this country, roughly 6 million folks have hypertension. It is a very, very serious problem. And hypertension affects blacks more than anyone else in this country, in particular blacks between the ages of 35 to, let's say, 50, because of obesity, untreated hypertension, poorly treated hypertension, stress of different types, etc., etc. You got to understand the interaction between obesity and hypertension. You have a country whereby you have epidemics involving hypertension, whereby you have 4.2% of adult women in this country are hypertensive, and you have 35% of adult men are hypertensive, and 17% children and adolescents suffer from hypertension. This is an epidemic. Of all the developed countries in the world, the U.S. have the highest rate of obesity than any other developed country. It is a crisis, and it's getting worse. Now, when the pressure becomes elevated because somebody suffers from it, and 97 to 98% of all hypertension are due to essential hypertension. The rest, 2 or 3%, are the result of pheochromocytoma and or what we call renovascular hypertension. Those are very, very rare. Not too long ago, I found myself in the middle of a major controversy at a hospital that I should not name, but it's located in White Plain, because a patient of mine was admitted from the emergency room. A whole lot of ugly stuff went on that it would be inappropriate and unethical for me to discuss. Suffice it to say, I was awakened at 3 o'clock in the morning to come and try to prevent this guy from bleeding into the brain. And so I did what I had to do and took care of the problem and discovered a whole bunch of other stuff. Now, the controversy was the blood pressure was elevated in this particular individual, not because he had received the treatment that he received in the ER, but rather because he had pheochromocytoma. Now, clinical medicine ought not ever be practiced just based on tests alone. It has to be practiced based on clinical judgment and evaluation that comes from a doctor's experience. At the very beginning, at the first glance, I know that this patient did not have pheochromocytoma because there's a classic presentation of the typical pheochromocytoma as well as atypical pheochromocytoma. The chapter in this book, chapter 1, the art the art and practice of modern clinical medicine is on hypertension. And in any event, pheochromocytoma in combination with neurovascular hypertension represents somewhere between 2 and 3% of the total cases of hypertension. Suffice it to say that once the patient becomes, by the way, chapter 7 in this book is on congestive heart failure, okay? Chapter 7 in this book is on congestive heart failure. Once the blood pressure becomes elevated, some of the things that happen, obviously, is the damage to the high flow blood vessels that then can cause occlusion to occur inside the arteries and different caliber of them, resulting in plaque formation that then can lead to ischemic heart disease, etc. And then, of course, that can cause the heart to become enlarged that way. The next problem, of course, is because the pressure is so high and the muscles of the heart becomes enlarged. Once they become enlarged, hypertrophy sets in because you see the muscles of the heart, the muscles of the heart, when the pressure is high, become stretched, and there's only the extent to which the muscle can stretch. If you take a rubber band, you could pull it and pull it and pull it. Once you can pull it no more, it's going to pop. Well, the muscles of the heart is the same way. When the heart pumps and pumps and pumps and pumps, the muscle becomes enlarged and enlarged. Just like you go to the gym and you're doing exercise, the bicep is going to become big and enlarged because you're constantly pumping the dumbbells to make the muscle bigger. The same things happen. So the heart becomes enlarged, and it reaches a point where it can no longer pump appropriately, and it fails. You don't need anything fancy. There are dozens of things that can cause one's heart to fail. Ultimately, believe me, I know all of them from the top of my head, but we're not talking about that. We're talking about the effect of hypertension. Hypertension. Let me give you an example of what the normal size of an adult heart is, like this one. This is the normal size of a heart. This comes from this book that I wrote years ago, Men's Health and Wellness for the New Millennium. That's a book that I wrote about men's health years ago. This is the normal size of heart. Look at this here. Look at how big this heart is. This is when the heart is hypertrophied, it is enlarged, and it's failing. It's failing. You have evidence here of water that's beginning to accumulate. So this is an enlarged heart, which is normal heart, okay? So this is just to give you an example. All right, so once that happens, then a whole host of stuff can develop. And then before I get to the symptoms of congestive heart failure, I have this very interesting phone call last night, and a very nice lady who resides in White Plains left me a message. Unfortunately, she didn't leave her phone number. I hope she's listening to this show so she could give me the number so I can call her back. She wants to have access to a copy of this book. She thinks she could probably get it in the White Plains Public Library. The answer, madam, is that you will not be able to. You may say, why? Well, the phone call she left was she was so upset because when I spoke about last week of the incredible racial injustices that I have suffered at a hospital on Post Road in White Plains, she was upset about that because she knows me. She sees me in the city all the time. She couldn't believe that I had experienced all this ugly, terrible thing that I suffered there. I mean, I need to say to you, however, the present non-physician administrator in charge at White Plains Hospital is not involved in any of that stuff. She has nothing to do with it. Those things preceded her. She's not that type of individual, and I want to exclude her from anything that I say having to do with White Plains Hospital because she's a fantastic person doing a great job. The reason why, lady, you won't be able to get this book at the library because my books are not allowed at the White Plains Public Library. My books are not allowed at the Greenberg Public Library either. I know that for a fact because years ago I used to actually take a copy myself of my books to the White Plains Public Library, and I used to take a couple of copies to the Greenberg Public Library, and of course those days are gone for whatever reason. The color of my skin and my sex, being a black man, is very frightening to these folks. They don't want me involved. You could write a book, God is my witness, to teach rats how to dance, I swear to God, you're going to be invited to teas and coffees at the White Plains Public Library whenever they have them several times a year or whatever. They will never invite me. I've never been invited to any of that. And yet, I guarantee you, you could not, no matter how hard you look, find another person who's a writer, who's in the 20th and the 21st century that resides in White Plains, that has more credentials, no academic credentials than I have written more books than I have written, books that have saved millions of lives, that are relieving pain for millions of lives throughout the world. Not rat dancing book, high quality books that have been accepted by academia all over the world. I'm right here. I'm a resident of White Plains. I pay my taxes. I'm sure the taxes I pay somehow, in some way, find its way in supporting that library in one form or another. I will never be invited. You can't make this up. I mean, this is not Mississippi. This is not the Moondog in Alabama. This is right in the city of White Plains. I'm a citizen. I've done nothing wrong. I have no criminal records, nothing whatsoever. I'm an upstanding, law-abiding citizen, hardworking. Right here in the city, I'm a resident of White Plains. I will not be invited. I have never been invited, not even to tea. Some of my patients who've been invited, when they don't know how come I didn't see, I said, well, I'm not invited. I'm not allowed. My books are not, I know the reason. It's not just because I'm a black man. Yes, that's the main reason, but other factors and things that happen over the years having nothing to do with anything I've done wrong, I will not describe them to. I remember taking, I think, this book and another one, I believe, to the Greenberg Public Library myself. I drove there and gave it to them. I'm yet to get a phone call or a postcard to say thank you or whatever. Why? This is the evilness and the cruelty and the viciousness of racism. I'm just giving you an example. This stuff doesn't affect me in any way, shape, or manner because, as you could see, I'm still wearing a nice suit, driving a nice car, and I'm still earning money, and I still work for myself. Against the desire, I'm still doing it. But I'm just giving you an example, and I'm not complaining because I don't sell books to make money. In fact, this particular lady, I wish her to please leave me your phone number so I can give you a copy of this book for free. I'll sign it for you because I appreciate the phone call that you left. Because if you left me the number, I would have called you this morning to tell you to please stop by the office to get a copy of the book. She would like to read it, but don't look for it in the library. You can't make this up. We're in the middle of White Plains, which is a big metropolis, right, attached to New York City. And the mayor is a great guy. I know him. He used to come to my health fairs. I support him. I refuse to bring this to his attention because that would be pettiness on my part. But I'm just telling it to you so that the lady, since she left me the phone call, I'm letting her know why she's looking for this book in the White Plains. She will not find it because they're not going to be allowed it. Yet this book is found in libraries all over the world. It's sold online. My town, where I reside, where I pay my taxes, will not allow my book to be there because I'm a black man. Can you imagine that in the 21st century? They're going to deny it. And I can guarantee you, I would put a chair right there. If they were sitting right next to me, I'll tell you exactly what happened. They would put their face like that to find out. I'm a journalist. I did the investigation. I know exactly what transpired, why my book, it is a shameful, disgusting, ugly situation. Okay, but enough be said. Let's get back now to, was my answer to the lady who left me this very nice phone call. See, I have this situation where I have this incredible ability that I have a show that when people do things to me, I'm not taking it anymore. From now forward, you guys do things to me, I'm going to discuss it on the show. Like it or not, take me to court. I have proof it. I'll document it, what you've done. I'm sick and tired of your garbage. Okay? It's not my fault that you're not smart. It's not my fault. You're supposed to be. That's what you say to everybody that you are. But when I'm around, why do you feel so diminished when I'm around? I'm a poor old Haitian peasant, an orphan on top of that. And yet you're intimidated. Give me a break. Find something to do with your time. You're wasting your time. So, congestive heart failure. So the heart gets to the point where it cannot pump anymore. The patient then begins to develop symptoms. What are the symptoms? What? Shortness of breath, chest pain. Patient cannot sleep with one pillow at night. He or she has to have several pillows on his or her back in order to sleep. Cannot walk from here to there without stopping, with taking a breath. And then the patient begins to accumulate fluid in the lower legs. Sometimes the fluid accumulates in the thighs and the abdomen. That's when the right heart begins to fail as well. Because the heart has two major parts, the left ventricle, the right ventricle. The left ventricle does the bulk of the work. But when the left ventricle begins to fail, ultimately the right ventricle is going to fail as well. So you have biventricular failure. Because the right ventricle cannot do all the work by itself. Because the right ventricle has to process the blood to get enough oxygen into it, and then the left ventricle picks it up and carry it throughout the blood, throughout the rest of the body, in order to perfuse the body so we could become well oxygenated, etc., etc. Okay? All right, so that's how the patient might present to you with these symptoms. Okay, then what do? Well, you're going to carry out an examination. You take a history from the patient, then you can carry out an investigation. I mean, after the history, you're going to carry out a physical examination, I mean to say. The physical examination, the weight is very important. Taking the patient weight is super important because you're going to have a baseline weight that you're going to keep watching as you begin to treat the patient. So because you're going to have to try to remove the fluid. So that's very important. You document the weight. Make sure you take the patient's blood pressure. Listen to the patient's lungs. What are you going to hear in the lung? Well, in the lungs, if you have rales, you're going to hear certain sounds, rattling sound. We call them rales, stuff like that. Then you're going to listen to the heart. Well, the rhythm of the heart is very important because if the patient is in bad congestive heart failure, patient pulse rate might become elevated, rapid, because the heart can't keep up. It's trying to keep up. The way it's trying to keep up is to overbeat, which is making the situation worse for it, and yet that's what's going to happen. So the heart rate might be fast. Then you listen to see if the patient have murmur, certain murmurs, different types of murmurs. Then there's something we call S2 gallops, S3 gallop. Those are stuff that you either know them, don't know them, know how to hear them, don't know how to do them. I can't teach you these things by talking to you on television. It takes years of know-how by people who are older than you are, who have more experience teaching you how to listen to these things, and then so on and so forth, okay? So that's pretty much what you're looking for, okay? Then you're going to examine the abdomen. Very important because when the heart really is failing, then the liver might become engorged. And the engorgement of the liver can cause it to become enlarged. You might develop an enlarged liver, secondary to fluid that is engorging the liver. Look at the spleen. Examine the spleen, etc. And the wall of the abdomen can also accumulate fluid, what we call third space. Because when the right heart is failing, you have a right-sided congestive heart failure, that's when you're having a lot of fluid being accumulated throughout the body, including the face may be puffy, etc. Then this vessel might pop up. You could see that, so on and so forth. You either have to learn these things, know them or don't know them, okay? So the bottom line is that you really have got to understand how to do a physical examination when someone you suspect to have congestive heart failure. You got to learn that. In my case, I had to learn it on my own because when I was taking my physical exam course, it sounds, you can't make this thing up. There's a doctor who's still at Einstein to this day, who I thought was a great doctor, and he probably is, a great teacher, which he probably is, but he was in charge of the physical exam course. They used to take us to Jacobi Hospital once a week as part of that course. And then we show up at Jacobi once, and he had chosen a patient for me, a heavy-set Italian lady at Jacobi Hospital, but the lady refused to let me touch her. And then from that moment on, I never got another patient. For the entire course, I just stand there, cross my arm, and watch. You can't make this up, okay? So he never made an effort to find me another patient. And I took the course. And this is, you can't make this thing up. So I just stayed there and watched until the course was over and so on and so forth. So, and then he said, well, how did you wind up knowing how to do physical examination? Well, I taught myself. This is the truth. Taught myself. To this day, believe it or not, there's an instrument called the ophthalmoscope. I don't know how to use it properly because you're supposed to hold it when you examine it like that, the left eye is like that. You're supposed to switch hand, but I can't do it when I switch hand. So I have to stand in front of the patient when he or she's coughing on me to examine the left eye and the right eye. When if I know how to switch, I could do it without standing smack in front of the patient. You can't make this up. That's the only thing I do it. Yes, I do it well using my right hand only, but I can't use the left hand to hold the ophthalmoscope to examine the patient because I never learned it that way. So you can't make the, and this is no criticism. I'm just telling you, I've been teaching people, doctors now, for intern, resident for 43 years, and this is how I was treated when I was a student at a good medical school. I never complained. I never went to anybody complain. Keep my mouth shut. But I'm just telling you, to this day, I had every single thing I learned on how to examine a patient, I taught myself. This is true. You can't make this up. Because when I took the course, the guy never bothered to teach me because he wasn't getting involved in the racial issue as him having to find me a patient because it was an ugly experience. But listen, I kept my mouth shut and I went on my business. This wasn't the first time. There was another guy who we had to stay there with this guy who used to be a retired chief of surgery at Jacoby. They give him something to do. They gave him a course. 6 of us had to go there every afternoon and sit with this man. And everybody got an evaluation. I'm still waiting for my evaluation. The guy is dead in the grave now. He never sent one in for me. Okay. He's dead in the grave. I have never received an evaluation from this guy to this day. And you can't make this thing up. And I'm just telling you things, they're ugly, but I have to get them off my chest. That happened to me while I was in medical school at Einstein, which is a fantastic medical school. I think they just celebrated their 68th anniversary, I think, something like that. It's a fantastic school. But this is what happened to. This is what racism, how pernicious this thing really is. Okay? You can't make this up, okay? And I had to survive all that stuff. And yet, myself, I've given back 43 years of teaching pro bono. I taught at Montefiore 2 months a year for 25 years without any money. I even had to pay for my own parking. 25 years. Okay? And when I got sick, I couldn't go. I got this incredible letter from the guy who was running the department. I don't know where he is right now, telling me how great a teacher I was. They want me back, blah, blah, blah. And they gave me a 25-year evaluation of teaching using the German system, which is a 6.0 is maximum. After 25 years, I was a few percentage from the perfect 6.0 for teaching at 25 years at Montefiore. And then I got this bunch of jackasses over there, not all of them, some of them good people, think that they're smarter than me. Can you imagine that? I got almost a 6.0 perfect at Montefiore for 25 years of teaching, and I'm working here in White Plain. You got these guys who didn't make it, frankly. Many of them flunked out of the training program. That's why they're here. And they see me every day, they think they're better than me. And they get treated, but in fact, they put them in charge of me, some of them, okay? So this is craziness what's going on, okay? So in any event, we got a lot of stuff to talk about congestive heart failure. Listen, I'm going to talk to share with you some of the experience stuff that I dealt with from here forward. I'm not going to take these things to the grave with me. I'm going to tell you some of them, and then they should stop doing them. They don't want me to talk. Stop messing with me. Then I won't sit there and expose the garbage and the racial nonsense that's going on. If they don't want me to talk, stop doing it. Because if they don't, I'm going to keep talking about it, and I'm going to expose their nonsense, okay? Because I'm sick of it. And then, because they can't touch me anymore. They can't do anything to me they haven't tried already. In any event, next week, I'm going to continue to talk about congestive heart failure. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.